Is going to be Josh Archbault. He's a senior fellow at the Foundation for Government Accountability. He co-authored the nationally acclaimed book, The Great Experiment, The States, the Feds, and Your Healthcare 2012. Josh's work has earned coverage in outlets including the Wall Street Journal, U.S. Today, the New York Times, Fox News, NPR, Money Magazine, and National Review Online. He's also a regular contributor to the influential Forbes.com blog, The Apothecary. Josh holds a master's in public policy from Harvard University's Kennedy School of Government and a BA in political studies and economics from Gordon College. Josh, how are you today?
I'm doing well, Chris. Thanks so much
Good.
for having me on.
No, thank you. As I opened the show today, I was saying that, Congress has had a 10-day recess, and now health care and tax reform and all of that's going to be back on the front burner. We've had health care pass the House, but it obviously looking like it's going to hit some roadblocks in the Senate. We have senators saying that they're going to come up with their own plan, and the Republicans seem to have a self-imposed deadline of trying to get health care reform repealed this year. You're with the Foundation for Government Accountability, and you guys have a very interesting health care plan. I read something a few weeks ago that the big sticking thing with healthcare is pre-existing conditions, and that's about 3% of healthcare, or people in healthcare, but it accounts for like 25% of the cost. Tell us a little bit about your foundation's plan.
Sure. Yeah, absolutely. And I think what's really important is what we're talking about in healthcare is cost, ultimately. And can people afford their health insurance premiums? And one of those drivers is this sticky issue of pre-existing conditions. For those listeners, pre-existing conditions is a wide term, but think of cancer, for example. That's one example of a pre-existing condition. And so one of the things that we do at FGA is we actually try to learn from the states. And so one of the lessons here was that before Obamacare passed, there was actually a couple states doing something very creative, and the state of Maine in particular set up a program that helped do two things. The first one was it guaranteed access to health insurance for those with pre-existing conditions, and they actually did it at the exact same rates as everybody else. The second thing it did is it reduced premiums for everybody, young and old people, so you got more people into the market. I think, thankfully, actually in the House bill in Congress, there was one amendment to that bill, and it actually took this Maine-like program and put it into the federal repeal and replace bill. And I think I'm optimistic that if a provision like that ends up making it through the Senate process, we can actually live up to that policy decision of guaranteeing coverage for those people with cancer and other really expensive diseases, but also drive down premiums, which has been one of the single biggest failures of the ACA.
It's been kind of painted that Susan Collins, a moderate Republican from Maine, is going to be one of the main sticking points of getting a health care bill passed in the Senate. And she is actually the Maine senator, and she has talked a little bit about what they've done up there. Her being a moderate conservative, automatically, I'm kind of poo-pooing. Was automatically poo-pooing the plan. Give us a little more details on it. How exactly will this reduce premiums?
Sure. So one of the things that most folks don't understand about health insurance is that the health insurance companies are pricing their plans in two ways. The first one is how much does healthcare cost, or how much are they negotiating their rates with hospitals. The second one is about risk and uncertainty. So they often health insurance companies will build into the price of health insurance a certain amount of money, or risk, if you will, extra premium dollars, just so they don't lose their shirt, if you will, so a number of people get sick. So what this program does is, let's say two identical brothers walk through the front door, and when they apply for health insurance, they fill out this little health questionnaire, and one of the brothers has cancer. Well, they both experience, and the way Maine set it up, both get the same health plan, same plan. The plan looks exactly the same in premium-wise. But now we know that this person with cancer has been designated for this program. And so it guarantees them coverage. What ends up happening is for that individual, 90% of their premiums get put into a pot of money. And then in Maine's case, they put a $4 per member per month fee on all the policies in the states. And so the insurance company actually knew who the person was with cancer up front. They don't know that under Obamacare because they can't ask any questions. And then they also know that if that individual racks up $1 million of claims, that they will get some assistance from this pool. What's nice about this is it doesn't include all sorts of government involvement. The insurance company doesn't. They actually have some certainty of who's going to be the sick person because they know that up front. That's what allows them to drive down premiums. I know it sounds really, really complicated, and most things in healthcare are.
Right.
What I think is beneficial of this example is that it's already been proven. It's a state example, and this isn't necessarily a right or left, conservative, moderate reform. It's a state reform that actually worked, and it solves the political problem that we have in this country of does seem to be a commitment to trying to help those with pre-existing conditions, but also we have to figure out a way to drive down premiums. I think what is really telling, and Susan Collins certainly is in the more moderate camp, but the person who offered the amendment in the House was Representative Gary Palmer, probably one of the most conservative members of the U.S. House of Representatives from Alabama. And for him, this was one way to be able to deliver on the promise of driving down premiums. And I think hopefully if the Senate can get their 51 votes together on all the different sticking points, this will be one thing that survives that process.
Can this plan be combined with the House plan and get votes of moderate and conservatives in the Senate and the House? Would they go for this? Does this have support of conservatives, this Maine style bill?
It does, and I think that this is one of the few areas in healthcare where there's a good trade-off for both sides. So for moderate, it is that you live up to that promise of helping everybody with pre-existing conditions like cancer in all circumstances. In fact, you don't charge them anymore, which is been one of the controversies that we've seen over the House bill related to another provision in the bill that we can talk about. But for conservatives, it does deliver, and I think there is a belief on the conservative side of the aisle that any repeal and replace bill will be judged on one thing and one thing only. Can it drive down premiums? And so can you come to a political compromise of sorts where you live up to both of those promises, driving down premiums and helping those with pre-existing conditions? And I think the Maine program is successful in that. Now, that's just one piece of this big healthcare puzzle, but I do think it's innovative, it's creative, it's a tested state reform that a number of other states would gladly take the opportunity if presented.
And that's what I was going to ask. Is this Maine plan, if it's adopted as the national health care plan, is this something that's going to be a blanket thing across the country? Or, as they always say, states are the laboratories of democracy. Are they able to, tweak these things, or will they have that capability?
Yeah, they certainly would. I think, as you mentioned, this is a moving target here in the Senate. And so pretty much anything I say could change in the U.S. Senate as this bill makes its way through the process. But I think what the original version that is being discussed in Washington right now would say, we need to get premium relief to Americans immediately. And so there would be probably a federal program set up right away, but very clearly within 2 or 3 years it would devolve down to the states. I think one of the things that's really creative and the way that the program worked in Maine was they actually looked at their local health claims and they found the 8 conditions that were driving costs up the most. Cancer, again, in many cases. And so those people were automatically enrolled in this program. What is nice about it is it can be tailored to the state. So in Missouri, Alabama, Colorado, California, they may have different health conditions that are driving their healthcare premiums, and states would tailor these sorts of reforms if they were running them. But the principles of identifying risk up front, helping those with pre-existing conditions, allows the insurance companies to drive down premiums for every age group, and I think that's what most Americans want.
Yes, it is. Hey, Josh, this is good stuff. Give the folks out there a website or somehow they can reach you and to get information about the Foundation for Government Accountability.
Yeah, FGA.org is our website. We have both a number of federal health and welfare reforms, but also a number of state reforms if people want to learn more.
Josh, I appreciate your time. Really appreciate it, and I hope we can have you back sometime.
Great. Thanks so much.
Thank you.